Tonight, does the cure for cancer already exist? Right inside our own bodies?
The power is in you. The power is within us.
This man says yes, and he's not your average doctor.
We truly have a chance to change the paradigm.
His prior breakthroughs made him billions. Now he says he's using his money to buy more time for cancer patients.
I'm using my own resources for all of humanity.
These patients say his anti-cancer protocol has reversed their condition.
When I saw this thing on my neck going away,
man saved my life.
The published peer-reviewed data confirms he's already saved hundreds. But despite all those success stories, the doctor claims the government is blocking him from saving millions more.
10,000 desperate requests daily, every day. Doctor, please help me. It's very hard for us literally to play God.
Is he blurring the border between science and salesmanship?
What do you make of the criticism that your pitch is stronger than your proof?
Or is the medical establishment trying to stop him while patients are dying?
You talk about this being political.
Political how?
It's a story told through microscopes and macroeconomics, a story that stretches all the way from the White House.
The only person who can change that is the President of the United States.
To your house.
Every morning I wake up, I know I'm one day closer to being cured. Thank you for what you've done for me.
That's what's also inspiring me to fight.
Killing cancer. Good evening. I'm Chris Cuomo. First things first, yes, you may laugh at the mustache, but it's here for a serious reason. I'm growing it with other members of my volunteer fire department to raise money for men's health issues, including cancer. And that, coincidentally, is what our show's about tonight. The National Cancer Institute estimates that more than 600,000 Americans will succumb to cancer this year alone. But the man you'll meet tonight believes he can change all that. He claims to have found the key to killing cancer. And he says the only thing preventing it from maybe saving your life is your government. Should we believe him? That's the question we're going to try to answer right now. What was life like before cancer for you?
Well, I was very active. I led a great, existence.
It was back in 2015 when Jim Johnson went in for a regular checkup. He was an active 57-year-old and felt perfectly healthy.
And it turned out that I had head and neck cancer. I had a tumor on my tonsil. When I had to tell my wife that I had cancer, that was really, really tough because I knew what I was going to put her through.
The road for cancer patients is never easy. The good news is survival rates have been rising steadily, but so has the number of cases. It's projected that by 2035, more than 22 million of us will have heard the dreaded words, "You have cancer." Those words are hard to hear, and they can be hard to say.
How do I tell somebody that they're going to die? I'm very honest. I'm very honest as to what we can do and what we can't do.
Dr. Simon Hagi is an oncologist in Irvine, California. He specializes in glioblastoma, the most aggressive and most common type of cancer that originates in the brain.
I try to level with my patients and their families. I try to set realistic expectations. The handful of patients where I've helped them survive 5, 10, 20 years, it's still like 1 in 1,000, right? It's a small, small number.
In an age where modern medicine has eradicated or at least controlled lethal diseases like smallpox, polio, even AIDS, why does cancer remain the so-called emperor of all maladies? Well, those other diseases are caused by foreign pathogens, viruses, bacteria. We know how to make vaccines to help our immune system defeat those. Cancer is different.
These cancers have found a way to hide from the immune system. And this is what makes it so difficult and so scary.
Think of it like this. Your immune system is like an army of white blood cells and other cells called antibodies. Each type of cell has its own function. Some attack viruses, others attack bacteria, but cancer cells come from our own bodies, and they know how to avoid and disarm the immune system. In other words, they've gone rogue.
These cells do not want to die, and they will stop listening to the rest of the body and no longer are performing sort of the natural function of clearing themselves or stopping to divide.
The problem with cancer is it's yourself. It's a complicated problem, and it's individualized and it's personalized.
Dr. Stephen Finkelstein says the entire field is desperate for change.
There's so many patients with cancers, afflicted with cancer, that we could do so much more for.
Enter Dr. Patrick Soon-Shiong. A surgeon by trade, he's more than a doctor. He's a radical thinker who's become a multi-billionaire after taking 4 companies public. This clinic in El Segundo, California, is where the good doctor is plotting to defeat cancer for good.
I wanted to create a system where patients could come and get the next generation of therapy, and this is what this building is.
Now, how does this fit into your vision of what needs to happen?
You will see what we have here is where all innovation happens.
But Dr. Soon-Shiong's interests extend way beyond medicine. He's a huge basketball fan, so he purchased part of the Lakers. He likes journalism, so he bought the Los Angeles Times.
We have now evolved into the digital era.
And he likes TV and movies. So right around the corner from the clinic, he built this gigantic studio to make them.
This doesn't have anything to do with medicine. And I don't understand how you can be in the movie mogul technology business and in the biomedical space. What is that about? How do you explain that?
The Lakers was a separate passion that actually kept me sane, actually. I was very close to Kobe. The LA Times, to me, was an opportunity really to educate and inspire. I really look upon this opportunity to create a platform to inspire and educate, because that's how I grew up in apartheid. I got inspired and educated by the newspaper.
Dr. Soon-Shiong was born in South Africa to Chinese immigrant parents in 1952.
So obviously you're not African, although you grew up in South Africa, but you were still handicapped by that system.
Correct. There was only 2 or 3 Chinese allowed to go into medical school. I was the first Chinese ever to work as an intern in a white hospital, ever.
What stays with you from those days?
The need to fight for the underdog, to fight for the normal, regular people.
He means people like James Johnson and singer-songwriter Billy Falcon. Patients, like so many others, set adrift on a sea of troubles when they heard the dreaded C word.
What was the diagnosis?
I had cancer on my tonsil, and it then made an outward showing on my neck.
What were they going to do?
Well, chemotherapy, but heavy chemotherapy and radiation for 8 weeks at the highest strength, which would basically, they said, you might never sing again, and it might affect your speaking voice.
Can Dr. Soon-Shiong really turn the tables in this deadly game? Well, you should know that like most people who've made billions of dollars, he's also made his fair share of enemies.
It's important to recognize that we have to do this in a stepwise fashion.
His first brush with controversy came in the late 90s, when after moving to Los Angeles and earning a reputation for performing pancreas transplants on diabetes patients, he got approval and financing to develop a breakthrough diabetes treatment, only to find out at the last minute that it could potentially infect patients with a virus.
I went to my financiers and said, we have to shut down my program. And on that basis, they sued me.
Those lawsuits from angry investors were settled, but Soon-Shiong had to abandon all his work on diabetes.
Suing, I get. Why would they ban you from doing research?
They wanted to continue this research with a big pharma company called Baxter. And they said to me, fine, we'll settle if you give us all the IP, all the technology, and you do not work on diabetes for 5 years. That was one of the most painful decisions of my life.
So it wasn't that you had done something wrong with the research. It was basically a non-compete.
Correct.
Done with diabetes, Dr. Soon-Shiong would pivot to an even greater challenge: cancer.
So my goal in life is to find the cure.
The move would bring him even more attention, both good and bad, making him successful beyond his wildest dreams and leading him to his biggest discovery.
That's the power within you to protect yourself from cancer. You know, life has its own reasons sometimes.
People who have met Patrick would say he is often the smartest guy in the room.
The war on cancer is a complex biological system.
Dr. Pat Soon-Shiong is known for thinking outside the box and inside a tangle of squiggles.
So what we need to do is activate all of them simultaneously in this complex dance.
The way he thinks about problems is really in many ways unmatched.
How does it get through?
He's famous for these indecipherable drawings that somehow express his thoughts about cells, cancer, and cutting-edge medicine.
I drew it in 10 minutes, literally just what's in my head.
This is also an example of why you're not allowed to draw plays for the Lakers.
Drawings like this led to Dr. Soon-Shiong's greatest hit, a chemotherapy drug called Abraxane. It uses nanoparticles to deliver a tumor-killing chemical more safely and effectively than prior treatments. But it can cost up to 10 grand a dose.
Your drug is much more expensive than other drugs. And that is pointed to, that's why this guy makes so much money. He benefits from the system. How do you explain it?
First of all, that's not a factual statement, but it's okay.
Why not? What is the fact?
Because it's not more expensive. So if you have survival for 5 to 10 years and you give the drug for 3 years and you amortize the cost of what it would survive, we are the most cost effective, number one.
So you're saying it's apples to apples. This is $6, this is $2, but the $2 one won't be as effective over time and will be administered more than the $6.
Correct.
The FDA approved Abraxane in 2005. 5 years later, Dr. Soon-Shiong cashed in, selling the company that owned it and pocketing billions. Others might have just retired, but Dr. Soon-Shiong was just getting started.
So what made you all the money? What gave you all the fame and the controversy? That's not what you want to rest on.
Correct. And the money is almost, you know, interesting. I grew up Anglican, my wife is Catholic, and the nuns tell me no money, no mission. What I think I want to do is get to the root cause so you can get a better outcome. So the idea is to cure cancer. Is there such a thing? You may ask. Well, I do believe so.
The cynicism is, no, you can't. We're always going to die. There are always things that are killing us. Everything else is marketing. How do you receive the criticism?
Because if you just look at what I call universal truths, okay, one of the universal truths is this oldest person on the planet just passed away. The University of Barcelona did the entire analysis of her blood, her tissue, and everything else. The only thing that they could find that was really positive was the protection of the immune system. She had an active immune system.
That's the key right there. Remember the immune system's army of cells? Dr. Soon-Shiong says one soldier in particular, something called the natural killer cell, has the potential to change everything.
You have in your body, God-given, a cell that kills cancer, that kills TB, that kills HIV, that kills COVID, a cell called the natural killer cell that is your body's first responder. We just haven't figured that out.
A healthy adult has around 2 billion natural killer cells in their blood. You can measure them with a blood test called the ALC, the absolute lymphocyte count. The doctor offered to test mine.
Let's see. Wow. I would think you had better veins than that.
It's already a bad sign.
He's long believed that this cell, properly functioning and activated, can kill cancer. The problem is, most common treatments in use today, chemotherapy, radiation, they might destroy cancer cells, but they come with a terrible cost. They also wipe out much of the immune system's army.
What goes away? The actual cells that are probably helping to fight the fight that we need.
Everything we've been doing, advertently or inadvertently, is killing the natural killer cell as we try to treat you. Think about that logic. Everything, from radiation to chemotherapy, has been inducing the destruction of the natural killer cell. So if you go to what you call first principles, the only thing that you need to protect in your body is your natural killer cell. And if you protect that, That's what actually not only prevents cancer, but treats cancer and maybe cures cancer.
Building on these ideas, Soon-Shiong came up with Anktiva, an immunotherapy drug he claims has the potential to target all forms of cancer.
Anktiva, what does the drug do in the for dummies version?
The natural killer cell all have on their surface a receptor that's looking for a protein that your body makes called IL-15, interleukin-15. The most important molecule is IL-15. Anktiva is that IL-15. It is the switch that actually binds to the NK cell and activates and proliferates them and make them supercharged.
In other words, when the natural killer cell is treated with IL-15, amazing things happen. The cell becomes stronger, more durable, and it multiplies faster, turning a normal soldier into the equivalent of the Incredible Hulk, powerful enough to take on those cancer cells and kill them. Take a look at this time-lapse video of a supercharged NK cell in action.
So the green is a regular breast cell.
Correct.
The red is a breast cancer cell.
Correct.
And the gray
is the natural killer cell. So the natural killer cell has the capacity to identify cancer cells, infected cells, abnormal cells, and selectively kill it. This gray natural killer cell is hunting it down on the left, identifying it as an abnormal cell, and killing it from the outside in. Look at it explode.
Watch again closely. This is the potential game changer. The first responder NK cell killing cancer right before your eyes.
If you give yourself Anktiva, even in healthy volunteers, it drives up your first responders, it drives up your protectors, and that's why I said the power is within us. We truly have a chance to change the paradigm.
But it's a long road from the whiteboard to the lab to the cancer clinic, where real patients get real results. To get there, you need to go through here, the FDA. And that's where this medical genius ran into a problem he couldn't solve.
You're a fix-it guy.
I'm a fix-it guy.
How come you haven't been able to fix your problems with the regulatory community?
With patients' lives hanging in the balance, time and hope may be running out.
I was truly devastated. I'm not sure if this change will happen.
Stay with us. Jim Johnson had a tumor on his tonsil. That was bad. The treatment? Worse.
So they radiated me, they chemoed me. And
where was your head on those kinds of treatments?
So I just sucked it up. I had a feeding tube for 120 days.
A feeding tube for 120 days.
My mother saw me and she burst into tears. You know you're bad when your own mother can't look at you.
At least Jim's tumor went away, at least for a while. Still, the ordeal of standard care is why many patients, as many as 19% according to one study, simply refuse it.
Singing hallelujah song.
Patients like singer-songwriter Billy Falcon. After learning he had HPV-related throat cancer, he chose quality of life over quantity of life and put his faith in his faith.
I believe one of my bumper stickers would be, I will not stop living to continue to breathe. I'm not going to do that.
So what was your plan?
My plan was to wait on God and wait on what I needed to do.
You hear the stories all the time. Celebrity cancer patients like actress Suzanne Summers, model Elle Macpherson, and most famously Apple founder Steve Jobs opting for alternative treatments.
I think that contributes to a lot of patients going out and doing things that may not have a lot of justification, okay? A lot of off-label therapy that is just out there and they may actually be hurting themselves. That's not what I want for my patients. I want honesty and I want options for them.
Dr. Patrick Soon-Shiong believes he's found that option. His drug, Anktiva, and its accompanying protocol he calls BioShield.
How do you balance the optimism of what you believe you can do with the risk of giving people false hope that this is going to be different than everything else?
I think that's why we started this in 2015, 16, 17. We were asked and got the FDA approval to treat patients who had failed everything. And we treated them, and they got complete remissions. And it wasn't sort of a one-off fluke or an anecdote.
The proof, he says, is plain to see. Take a look at these before and after brain scans.
Again, this patient had a brain tumor. Now, the brain tumor, the patient had radiation, chemo, and surgery. So we've taken patients who failed all chemotherapy, failed everything, and gotten this kind of response.
Very impressive as a visual representation.
There's no chemo in this treatment, no radiation in this treatment, and the tumor is now really reducing in months.
Spend any time in Dr. Soon-Shiong's clinic and you'll see there's no shortage of patients willing to attest to similarly wondrous results.
I'm extremely healthy, probably too healthy for my age. All of this is because of this treatment.
This was my tumor to start with, and then with all the treatments, it's now almost gone.
The success for me was 100%, and I've been in remission now 5 years.
It was Dr. Soon-Shiong's reputation for getting results like this that prompted a fateful phone call back in 2015. That's when then Vice President Biden's son, Beau, was fighting brain cancer.
So he had brain tumor.
And his family believes it was from the fires in Iraq, the garbage fires, when he was serving over there.
And I disagreed with the treatment that he was about to get, and I got a call in from Vice President Biden, and can I come to Washington?
When you were asked to come in and consult for Beau Biden, it was already too late in the process.
Yes.
In this moment of deep grief, Soon-Shiong claims he handed President Biden a folder about an initiative that he'd brainstormed called Cancer Moonshot. The idea was to get the federal government to fund a project that would be truly revolutionary, finding a cure that would make chemo and radiation a thing of the past. Of course, Dr. Soon-Shiong expected Anktiva, still an experimental drug at the time, to be a big part of that moonshot.
And the vice president at that time, he wanted you to spearhead that. And how hopeful were you at that time?
I was elated because here was an opportunity with a man that actually, at this level of seniority and power in the government, that could spur the collaboration for a common cause, for the common good.
He says he recruited several big pharma companies and academic centers to participate, only to be blindsided by the administration. With no explanation, he was suddenly excluded.
The day after we announced it, at the Congress, State of the Union, President Obama turns to Vice President Biden and says he's now have a second moonshot.
You know, last year, Vice President Biden said that with a new moonshot, America can cure cancer. So tonight I'm announcing a new national effort to get it done.
And that was the moonshot that all the big pharma and all the major academic centers went along with. I think they got $5 billion of funding, and I'm not sure if anything came from it.
Why do you think it went nowhere if they had all those people on board and time and money?
If they had went anywhere, there was incremental change of looking at another chemo, looking at another chemo combination, another checkpoint, etc. There was not transformational change or paradigm change that we wanted to happen.
What he's saying is that entrenched interests did not really want to embrace a new approach that threatened to make our existing treatments obsolete.
I know I'm on an uphill battle against many forces. Political forces, marketing forces of big pharma, making tons of money. Even marketing forces of the large National Cancer Institute cancer centers, whose profit and their bonuses to the doctors are based on the chemo they get. Imagine if I make you healthy. I should get a bonus for that rather than keeping you sick. Today's the reverse. I get paid more by keeping you sick.
Dr. Soon-Shiong would spend years fighting that battle, and soon the stakes would get even higher. When the COVID virus hit,
government leaders tell us these tighter restrictions are necessary with this invisible, deadly threat.
Suddenly, everyone started talking about the immune system, and then started worrying that the vaccine might have some unintended consequences.
Now, we may have something that has replicated itself and grown and changed in a way that could be causing cancer.
Correct.
That's next.
officials on high alert tonight, a day after confirming the first case of coronavirus in the United States.
Where were you in 2020 when COVID hit? Well, I probably don't look great because I have coronavirus. I found myself reporting on the pandemic from my own basement, where I'd quarantined after contracting the virus. I'm scared by this. I'm scared by the potential of this.
You ready?
But why are we talking about COVID in a cancer special? Because it's a known fact that some viruses cause cancer. Both Jim Johnson's and Billy Falcon's tumors, for example, were caused by the human papillomavirus, or HPV.
We do know that HPV-positive patients get cancer because of HPV.
When the pandemic hit, Dr. Soon-Shiong was worried that the coronavirus was also one of those cancer-causing or oncogenic viruses, since it was known to suppress the immune system's natural killer cells.
And I said, God help us if COVID is one of them.
So, do the approved COVID vaccines address COVID's cancer problem? Dr. Soon-Shiong says, unfortunately, no. They are effective at blocking the virus with antibodies, and Dr. Soon-Shiong says that's good. He's no anti-vaxxer, but he says it's not enough.
What you really need to do is prevent the virus from repackaging, and more importantly, prevent the virus from shedding and clearing the cell. The most important thing to do is to clear the virus.
He began developing a booster vaccine to do just that, again leveraging his favorite soldier in the immune system's army, the natural killer cell.
Our vaccine was one of the only ones that's now published, Frontiers of Immunology, that cleared the virus within 7 days.
Nevertheless, Dr. Soon-Shiong's vaccine didn't make the cut for Operation Warp Speed, and was even later denied permission for further development. You made it to like the round of a dozen or 14 that were still players.
I was number 8.
But you didn't make it to the final?
Correct.
Why?
This is where the dogma comes in. In virology, antibodies are everything. Create antibodies, because that will block and reduce the infection. But it doesn't clear the virus that gets into the cell.
That so-called dogma may have consequences we're still trying to measure, because Dr. Soon-Shiong says his worst fears of COVID came true.
COVID is acting like HPV and is what we call an oncogenic virus, a virus that can cause cancer and can take young children, create cancer, take people in remission, create cancer because of how it works.
And we gave it that chance to learn and to change by chasing it with antibodies instead of with antibodies and something that would kill it or flush it before it could mutate. When you look in tumors, what are you seeing?
There's now evidence that when you actually biopsy the tumors, there's the spike protein inside those tumors.
From COVID?
From COVID.
And then there's what happened with Jim Johnson. In 2022, he'd survived his HPV-related cancer for 7 years, and he'd taken the COVID vaccine. Then his doctor gave him some shocking news. The cancer was back with a vengeance.
First person that they know of on the planet that had HPV metastasize onto his liver.
And they didn't know why.
Had no idea why.
This is why I worry when I'm now seeing 10-year-olds with colon cancer. I had a 13-year-old died in a clinic with pancreatic cancer. I'm seeing a lady who was very close to me who had a thymoma 30 years ago, never had remission for 30 years, got COVID, and now it's got metastasis.
Fearing that a wave of COVID-related cancer is just beginning to hit us, Dr. Soon-Shiong spent 4 more years trying to get his drug Anktiva approved.
We have a license number.
But the moment of joy would be short-lived, as the good doctor's critics claim he's blurred the line between hope and hype. What do you make of the criticism that your pitch is stronger than your proof? That's next.
Okay, you should be able to share now.
April 2024. After years of anticipation,
We acknowledge receipt, thank you.
the Food and Drug Administration finally gives the green light to Anktiva,
the pioneering immunotherapy Dr. Patrick Soon-Shiong has been developing for more than a decade.
We have a license number. Activated natural killer cell for life.
The vision is transformative. Harvest NK cells from patients everywhere, or people even without cancer, like me.
This farm's going to fall off. You got it? Yep. Sir, I'm just joking.
Then, if and when they're needed, treat them with Anktiva to supercharge them, freeze them in units like this, and ultimately freeze out chemotherapy.
What is this?
This is cryopreserving your natural killer cells. So all the vials of natural killer cells that we take out, and we then modify the natural killer cells that targets a tumor, is frozen, taken upstairs to the clinic, thawed, infused in 30 minutes, and that's a treatment.
What is expected by the patient in terms of side effects?
You come in here, this is an outpatient, you'll get an infusion, and you'll get a little bit tired because of the proliferation of these NK cells and a red flare. That's it.
Dr. Soon-Shiong wants this in every cancer clinic, treating every type of cancer. And he thinks that's a reasonable goal, since other common drugs have been approved to treat other types of blood cell deficiency, regardless of the specific cause.
These two drugs have been approved for decades, for all cancers. We should have this approved for all cancers.
But the FDA had other thoughts.
Our drug is approved, believe it or not, just for a tiny piece of a subset of bladder cancer.
That's right. As of today, Anktiva is not available for patients with every other type of cancer: breast, lung, brain, you name it. For that to happen, the FDA says it needs more trials, more data, more proof of safety and effectiveness, and more time. Lots of time.
I've got patients 10 years, and you want me to do a randomized trial that'll take another 5 years, and response, I don't care. I almost fell off my chair.
Why aren't results like this, as obvious as they present, enough? Like, why is it that the clinicians or the FDA or whatever the standard is not impressed by this?
I think we stuck in the old assumptions. We stuck in the check the box, and we stuck in show me chemotherapy. Do a randomized trial against chemotherapy, knowing what the results of chemotherapy are. They don't recognize that this is a ubiquitous treatment of your immune system. You shouldn't ask what cancer is that. That's what we're trying to get the FDA to understand.
But maybe there's more to it than that. Critics have argued that Soon-Shiong has a history of making inflated claims about medical breakthroughs, of relying more on impressive images and patient testimonials than long-term peer-reviewed studies. In short, he has a reputation as a hype man that has harmed his street cred as a scientist.
What do you make of the criticism that your pitch is stronger than your proof?
I want 10 living patients to walk into the Oval Office and shake the president's hand. That, to me, is the proof. Living, walking people who otherwise had failed all treatments on this planet, alive. I don't know what other proof you can have. You know, it's not a fancy paper in the New England Journal of Medicine, even though we are published in the New England Journal of Medicine. We publish in the Journal of Urology, we publish in Nature. But that's not my goal. My goal is to really change the outcome of mankind.
For now, the only people allowed to take Anktiva are those with that one type of bladder cancer for which it's been approved, or those admitted to one of his clinic's ongoing trials. He only has capacity for a few. The rest, he must reject.
So here's what you haven't been able to fix, which is the demand.
10,000 desperate requests daily. If you look at this one, September 26th, doctor, please help me. It's very hard for us literally to play God.
Behind each message, a patient in pain, a family in crisis.
Well, the ones that get you have to be the kids, right?
So this is what's heartbreaking. If you look at this, my 2-year-old nephew is currently going through chemo. I mean, this is going on and on.
And getting accepted into any clinical trial for experimental treatment is no easy task. Just ask Jim Johnson, Eventually, he had so many tumors, his oncologist dropped him.
He said, "There's nothing more I can do for you. Your last chance is to get into a clinical trial." I tried to get into half a dozen clinical trials, at all the big hospitals in New York. In every case, the pharmaceutical companies kicked me because my case was so unusual. They were afraid that I would skew their numbers. They knew that their stock valuation was more important in my life.
Jim's last hope was getting into one of Dr. Soon-Shiong's trials. And that's when he finally caught a stroke of luck. He's been coming here to the clinic for treatment for the past 18 months. And the results, he says, are nothing short of miraculous.
Liver enzymes are down, lymphocytes are up, white blood count is back to normal. It's been 6 months since my last MRI. I have no new tumors. I got nothing. Man saved my life.
Billy Falcon was also admitted for Anktiva trial. He had the same kind of result.
In 3 weeks, this was gone.
3 weeks?
Yeah, 3-4 weeks, yeah.
What are your bloods showing?
My blood's been perfect. My blood, and I'm not a scientist at all, but every time they take my blood, they say your blood is perfect.
So there's no cancer that they're seeing?
Not in there at all.
Just last week, the latest test confirmed Billy's cancer is gone.
So this is Billy, and there's what he was talking about on his neck.
And he had this tumor, and as you could see, the massive size of the tumor. Within a couple of months, and you see the clinical output.
Yes, the medical field is rife with impressive individual cases that are anecdotally accurate, but statistically meaningless. Still, Dr. Soon-Shiong says that nearly 1,000 people have been treated successfully with Anktiva, most after standard treatment has failed. And the extraordinary results are the rule, not the exception.
We have now patients with bladder cancer alive, 10 years out. You call that a cure? Free of disease. Patients with Merkel cell cancer, 6, 8, 9 years out. People with metastatic pancreatic cancer, still alive today, 6 years out. And on and on. And we've got complete remissions.
But remember, they are among the very lucky, very few cancer patients Dr. Soon-Shiong is able to treat. Many of the rest are likely to die. And that is hard for him to live with.
Why do I have to make those decisions? Is it ethically correct and morally correct to allow patients to die just so you can pass through a regulatory hurdle?
A lot of people can't get into the situation that you're in right now. What do you think of that?
The people that can't get the kind of help I got, I think it's horrible.
That's what's haunting me. But maybe that's what's also inspiring me to fight.
Coming up, there's new leadership in the Oval Office and a new health secretary. Has this disruptor's day finally arrived?
I think the only person who can fix that is the president.
That's next.
The golden age of America begins right now.
When Donald Trump returned to the White House this year, he promised to tackle America's chronic disease epidemic.
And keep our children safe, healthy, and disease-free.
And in a move that raised eyebrows, he appointed the Maha firebrand Robert F. Kennedy Jr. to lead the Department of Health and Human Services.
News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
As a vaccine developer himself, Dr. Soon-Shiong says he doesn't fully agree with Trump or Kennedy. However, he does see the shift in leadership as an opportunity.
When Bobby Kennedy got brought on board, I believe fervently that he really was all about the immune system, and I think he still is.
This May, the entrepreneur doctor's mission took him to the Middle East for a meeting with both Trump and Saudi Arabia's crown prince, Mohammed bin Salman.
I said right in front of them that healthcare and the curing of cancer, the treatment of cancer, is the best foreign policy we could have, because that is for humanity rather than left-right. If we transport healthcare, curing of cancer, the technology, as foreign policy, that's the greatest opportunity to create peace in the world.
Soon-Shiong's critics take all this glad-handing as evidence that he's cozying up to the administration and making his media empire more MAGA to advance his own business interests.
So how do you convince people that you want to do something because you want to do good and not just do well, that it's all about making more money?
So I'm using my own resources and my own effort and my own time to actually figure out how we can actually improve cancer care for all of humanity. It doesn't matter in terms of the money, in terms of billions. But what does matter is no money, no mission. This is the mission.
A mission that other respected doctors support.
He has something that he's seen it work, and patients have gotten a therapy which has made their cancer better. And that's why it's so important to figure out if it works, to get it to a place where everyone gets access.
I think the rules need to be maybe a little different, maybe a little bit more relaxed, to allow for things and development to move faster.
Dr. Soon-Shiong continues to lobby the administration to get on board with his plans for eradicating cancer with his supercharged natural killer cells.
We've got more results, we've got greater results, and I think only he, as the president of this administration, can make that change.
And while the FDA is still demanding more data before approving his protocol for wider use, members of the administration have reached out personally, asking Dr. Soon-Shiong to help family members and friends stricken with cancer. The billionaire inventor knows that many are still alive because of his drug, still fighting, still loving, still singing.
How are you?
Dr. Soon-Shiong, I never thought I'd have the chance to thank you for what you've done for me and for so many others.
No, it's
It's incredible.
my honor, my privilege.
It's an incredible moment for me.
This is...
You're a miracle worker.
What gives you hope that you can help get us to a better place?
The hope I have is that this is unstoppable. It's completely unstoppable, what we're developing now. I just would like to see it in my lifetime.
You really believe it's not if, it's when?
Correct. The power is in you. The power is within us.
Let's end tonight with hope and prayers for the millions of people around the world living with cancer. Stay strong. Thank you so much for joining us. For all of us here at NewsNation, I am Chris Cuomo. Good night.